Okay, y'all, so I'm gonna do me a skin mask while I try to finish telling y'all about travel nurse. I'm gonna get through this, but I need to go back because I didn't tell y'all about when I worked at the health department. So, and this is the stuff I'm using for my face. And I'm gonna mix it with this. But anyway, so like I said, I got my assignment, did the little short quick orientation. It was 2 days with the nurse, which was fine. Because my recruiter had already told me to expect it. So after that, I was on my own. I was on my good old own, and I had 4 patients. So at this particular hospital at Emory, they at the time was magnet hospital. So I guess they had criteria that they had to go by. And one of the criteria was them having a good nurse to patient ratio. So on a bad day, I'm talking about a terrible day, I would have 5 patients. So, you know, this was a shock to me because I was used to having at least 6 patients. And sometimes 7 if things were really bad at my previous hospital. So, I could have stayed though. I remember I had listened to, you know, I was doing my little research or whatever on travel nursing, and I had listened to a nurse. She was saying that she came there from being on the travel assignment. She decided to stay. And what do you know? I got that, and I really didn't want to leave, y'all. But I had got kind of homesick. So even though I was like going home every other weekend or whenever I was off, I would try to go home. And so I had got kind of homesick. Unfortunately, I thought I was missing some, and I don't know why. You know, I don't know why, but I did. And so I stayed there at their hospital for 6 months. They had offered me a position on the floor. And, you know, everything happened for a reason. But I should have, you know how people be like, I don't regret nothing that I did. Yeah, that's something I regret that I didn't take. I should have took that position. But I do believe everything happens for a reason. I do believe that. So, at any rate, my experience there, I give that hospital a 10. It was a good hospital. So,